Hi, so I just wanted to talk here for a few minutes about this ankle surgery that I had 5 going on 6 weeks ago, the Brostrom procedure for tightening the main 2 ligaments in the ankle, the ATF and CFL ligaments, which are located on the basically exterior of the ankle. So my story about this actually kind of goes back a ways to about 2011. I think the first big sprain that I had was in about 2011. Was the usual painful sort of sprain, but then I had another one in 2013, which was significant. I was adjusting an air vent in my old apartment and fell and landed squarely on my foot. And so it was at that point that I could hear the problem with the tendons, because I think that was the injury that caused them really to slip and to come loose. And then over the years, people who are kind of experienced sprainers, like who have had multiple sprains, can attest to this. The ankle will definitely get weaker and you will be more sprain prone the more sprains that you have. So that's kind of what happened with me. I'm not somebody who does competitive sports, so I'm not like spraining my ankle every few weeks or month or something like that, but I think there are plenty of people who do during sports seasons. A long time ago I played soccer, and sometimes there would be somebody who sprained an ankle or whatever, but I don't know, maybe those were better days. But anyhow, so as I say, it's sort of an over a period of time thing. In 2015, I actually traveled to Mexico and was wearing a cast and on crutches for that trip, simply because I was a tourist, and that was like the easiest way for me to get around. I couldn't put weight on my foot. But then I remember in 2016, the next year, I had another really bad one. And it's like the more of them you have, the more problem it's going to cause. So finally, last summer, which would have been summer of 2020, I was out jogging and I had a problem with my foot that resulted in a partial collateral ligament tear. I landed the wrong way on it, and I think it was because of my ankle. I think my ankle at that point, was weak, and I rolled it, and it involved my large toe, the great toe. And so it was my toe that was killing me. And so I went to this doctor who had actually treated me for another problem I had with my right. In 2018, I had a fracture, a hairline fracture to my right ankle, along with a really bad sprain, which I got an MRI for, and I was in a boot and crutches for 6 weeks. So I went back to this doctor who had helped me with that, and had given me cortisone shots at that time. And so I went back to him and I said, I might have broken my toe. And he said, no, you didn't break your toe. Got x-rays. No, you don't have any broken bones, but I do know what happened. You've got a partial tear of your collateral ligament. And he said, so how did this happen? I said, well, I was out jogging and it just happened. And then he looked at my ankle and he said, you need to have your ligaments tightened. Because he could hear like the clicking and the grinding noise in my left ankle. And I said, how does that work? And he said, well, it's surgery. You have to go into the hospital. And I said, you don't do it here in the office. He said, no, because we have to have a sterile environment. And he said, but I'm not even doing those kinds of surgeries right now because of COVID, and I'm not going to be doing them for at least another 6 months, if not longer. So we flash forward actually a year. That was last July. Flash forward to June of the next year, almost 1 year later. And I went back to his office, and when I found out he was finally operating again, and he told me, yeah, let's go ahead and do it. So surgery was scheduled, done 3 weeks later, and really it was a pretty quick and easy process. At least it has been so far. I'm not done with this yet. I'm still on crutches and I'm still wearing this cast. So the surgery was done, and I was in and out of the hospital within 7 to 8 hours. And after about the first 10 days, I didn't have any pain. I had some intense pain during the first 10 days, but it was nothing that couldn't be fixed with just over-the-counter naproxen, which is kind of similar to Advil. I did not use it. Like I said, I didn't use any of the narcotic prescription that I had. So the total recovery time, like from gate to gate of this thing, is roughly 3 months in most cases. I think for most people, I think it tends to be about 3 months. It probably takes longer than that for, if you really are athletic and getting back to playing a soccer game, playing basketball, as vigorously as you once were. That's probably going to take a bit longer than 3 months. But as far as time out of work or whatever, I'm an accountant. I sit down and look at computer screen all day. So thankfully, my time out of work was only a week. If I was somebody who did like manual labor or something like that, I would still be out. 6 weeks later, 8 weeks, until I could walk again. So that's not a good scenario. So anyhow, but as far as it goes, the procedure involves, as I say, tightening the ligaments. I think if you have a really bad tear or something, if it's like completely torn or whatever, they might do I think what's called an allograft, and they take a cadaver tendon and either insert that or insert part, just like replace part of it. But they will excise out. The surgeon will excise out the portions of portion of the tendon that is bad, and will tighten it up surgically. And then what's also done is holes are drilled in the fibula bone. The fibula is the smaller bone of the leg to which these tendons are attached, and there are sutures that are placed, surgical not rods or pins, but sutures. I don't know exactly what material the sutures are made out of. I don't know I don't think it's metal, but they are placed through these drilled holes, and basically the whole complex is the ligamentous complex is tightened up. That's the best kind of verbal explanation I can give. As I say, there are videos online showing a procedure like how this is done. But I remember when I got into the operating room, my doctor was telling the surgical techs the stuff that he was going to need, and he said, I'm going to need a drill bit, of this certain size, and I'm going to need this, and then he said, and then I'm going to need the materials for the cast, 4-inch casting tape, whatever, So they got all these things, and then I was out like a light under general anesthesia, and then woke up he said it took about an hour and 15 minutes to do the whole thing. I don't think mine was probably as nasty and terrible as some others, because I've heard and read some stories from other people who had MRIs prior to this that showed markedly thinned tendons and torn CFL, torn ACL. They probably didn't even have that many incidents that caused that. They might have just had 1 or 2 incidents. And, I mean, that's enough. If it's not treated, then your ankle is just going to go to hell over a short period of time. So, anyway, the protocol for this, is putting a cast or splint on during surgery. And I think some people get a splint on, and then they'll go to the doctor's office a couple weeks later and then get a cast. So in my case, I got the cast while I was under the knife on the operating table. And then 2 weeks later, I went back, and the incision in my ankle was checked by my doctor, and then the cast was actually had to be opened, if you can picture this, like cutting a hole in the cast. And then that hole was replaced, just bandage it over with some more fiberglass tape, and then opened up again the next week to take out the skin sutures, the staples that were put in. And then next step is removal of this cast and going into a walking cast, which I'll be in for another 3 weeks. And then after that, I don't know. It's probably going to be physical therapy, and I've never been an advocate of physical therapy because I really think it's a waste of time unless you've really got, if you're in a multi-car pileup, or you fell off a cliff, or you had a bad skiing accident or something like that, and you got multiple broken bones, broken ankle, broken arm, your back is thrown out, dislocated spine or something, then PT is good. Then PT can really be useful. But if you've got, even if you broke your leg or something and you've got screws in a plate, PT is really not going to probably help you all that much. You can go, I mean, thank God we live in this day and age, we can go online and look for resources and simply do this stuff at home, because most of what you're going to be doing and what the physical therapist is going to tell you to do is stuff that comes off the internet. That's where they get it, oftentimes. I'm not saying they're not qualified to help people who really have big problems. But if you got, like, if you sprain your ankle really bad, like a 3rd degree nasty black and blue sprain, physical therapy isn't probably going to help you that much. I know this because I've been that route before. So I don't think they're probably going to be able to do. I'm predicting already that, you know, if I do have to go, they're probably not going to be able to help me much with this beyond what I can do at home. You know, I've actually got all the, like, these bands and stuff. They give these rubber bands, these big old rubber bands that you stick on your foot, and you, like, write the alphabet, you know, like this. I can see it coming already because I've been down this road, and it's an expensive road to go down. If you're paying, like, your insurance co-pays, these robbers, they'll take you, like, for every penny that you've got, these, like, $50 or $60 insurance co-pays. You know, every time you go to the PT office, and they got all this elliptical, you know, treadmills and stuff like that, and it's just, I'm not saying it doesn't work for certain cases, but for stuff, you know, for something like what I have, you know, it's not recommended. So anyway, I'm looking forward to, you know, to walking again, and, you know, this will probably, you know, hopefully be the end of my ankle problems. And before I totally end this video, I'll give you a bit of a close-up of the cast. So, looking at this, so this is a nice big kind of like football player cast. Only I guess a football player cast will, like, go up, you know, up and over the knee. Long leg cast, but that's not what this is. So this is just a traditional short leg cast. It's kind of showing its age, showing its wear, which is a good thing, you know. Nice, well-worn cast. So as you can maybe tell there, like right here, this is the site, you know, the surgical site was like there, right there, and my surgeon actually locked my 5th toe, which cannot really be seen there, and kind of spooled over some material there, which is now really pretty loose, but at the time I got the cast on, it was really kind of tight. He didn't want me moving my toes, you know, lest it affect the repair of the joint. But my 5th toe is kind of locked, so I can't move it, and that is actually a casting technique, to, like, lock the 5th toe and make sure, like, the casting material goes up and over it, so you can't move the 5th toe, the 5th metatarsal, as easily. So this is about how I've been for, like, the last, you know, 5 or so weeks, you know, because for no other reason than it's been really hot. But, you know, when you've got it, when you're in a cast and on crutches, you just want to be as comfortable as you possibly can be. So this cast is actually starting to get a little bit loose now with calf muscle atrophy. I don't think it's really that bad. I mean, I don't think it ever gets to the point like I think some people are kind of fanatical about that. But of course, you know, once you start to rebuild and everything, and start walking again, then that situation definitely improves. But when I got this cast on, it was definitely tighter than it is right now. Now it's kind of starting to feel a little bit loose. It's still holding my ankle well. My ankle is still locked, and, you know, so my doctor said you have to stay completely off of it, which I have been doing. I'm very proud to say I've been in 100% compliance. I have not walked on this foot since June 25th, and it is now August 1st. So I'm doing, or I take that back, July 31st. Whatever, who cares? So everything is going well thus far. I think I'm going to, you know, endure some more trials and tribulations once I start trying to, you know, once I'm walking again, and, you know, but I'll definitely cross those bridges when I get there. I've been down this road numerous times before. You know, once you have a sprained ankle and you start to walk again, you know, you're going to be limping for a bit, even, you know, after you get off the crutches, and it's just how it goes. And you just take it one day at a time, and before you know it, your normal gait is, you know, restored, and you're all good, and everything else is good. So I thank you very much for hanging with me with this 15 minutes, and have a wonderful